So the chapter two, the title is "Cracks in the Institutional Wall." Before we even talk again about the speaking points, I would like you to talk to me for a moment about the backstory of the title. I know you have one.
Well, the idea is that I learned about mental institutions at a young age, a fairly young age. I was a teenager when I first started to handle situations like people dying, because I was a nursing
Yeah.
student at the age of 16. And so I was in situations where I didn't know what to say. Like one time, a woman died in the labor room when she was giving birth, and I
Yeah.
witnessed it. And there's the father standing nearby. And so, what do you say? And at 17, I didn't know what to say. So I was always interested in finding out, well, what do I say in this situation or that? So that was therapeutic interpersonal communication that I was starting to learn. And I always wanted to know that. I kept on
Yeah.
asking the instructors, so what do I say in this situation?
Yeah.
So, so from early on, I had this understanding, and it changed my perspective, I think, from other people's at the same age, since I was a teenager. So I would understand that the person's telling me something, and I'd look underneath the surface to see, well, what are they really saying?
Mm.
And I thought that everybody knew that. I didn't find out until I was in nursing school, and a professor called me in her office after class, and we had this assignment, and it was on psychiatric nursing. And she said, we have to go out and interview people, and we have to ask them questions and write it down and then figure out what they're saying. It was in a column form. So I did that, and I thought the assignment was relatively easy. And so I brought it back and handed it in. But she called me into her office, and I thought, oh, I got a bad grade on it or
Yeah.
something.
Yeah.
But when she sat me down, the first question was, well, how do you know this stuff? How do you know what the
Mm.
person's really saying? And I said to the professor, well, don't you know? You're the professor. And she said, no, it's a gift, right? And it's
Ah.
hard to teach. So she wanted to know about it. And so I started to think, well, maybe there's something to this, but it was still part of me. And you don't know what other people are thinking. You just think everybody's like you when you're
Mm.
growing up.
Yeah.
So, so it started there. And my interest, when I went to actually have an internship at a mental institution, when I really began to question the sanity of it all, especially
Mm.
the treatments that were going on at the end of the 20th century. And I would ask questions, and there were no answers. But the idea was that I witnessed something, and they were changing at the time in the mental institution. This was at Kings Park State Hospital on Long Island. And I would ask questions, and I said, well, what they presented, that everything was fine. And I'm saying, wait a minute here. From my perspective, it's not fine.
Right.
And the little children on the wards where they were being punished because their parents were having a divorce, and they were acting out, and they were given drugs. Or when the young woman was, she had obsessive compulsive disorder. Um, I don't know if they called it that at that time, but at any rate, she was one of my patients, for the day.
Yeah.
And I witnessed her just with a mop cleaning the floors of the institution,
Ah.
of the hospital unit. And I noticed that she didn't wring out the mop. She didn't have fresh water. She was just wiping the floors, which is
Yeah.
very much in the institutions. The patients did the work like that. They thought it was therapy. They thought that this was something that they can do. And so you can imagine somebody who is very meticulous about cleanliness
Yeah.
just taking the dirty mop and washing the floors as therapy. But at any rate, she was not very much older than I was at 18, and she had to be brought in for electroshock therapy. And it was eye opening for me. I had to pretty much drag her there, and she was holding on to talk about the institutional walls. She was trying to claw
Ah.
at the
Yeah.
wall, and she was trying to take the keys that were wrapped around my waist so nobody could take them. But she was kind of dragging me, and I was dragging her, escorting. They told me to escort her. And then I witnessed what happened on the table with the shock pads and the
Yeah.
airway, and had to be with her during the procedure, and how she didn't want to go into the room, and she was screaming. And then afterwards, she was just like a zombie like figure,
Mm.
not knowing anything, not seeing anything, as I bring her back to her room. And that was shocking to me,
Right.
back then. And the early practices, of course, were even worse when they first started this in the 1940s, because they didn't give them proper muscle relaxants. So there used to be a lot of broken bones along with it.
Wow.
So that was my introduction there, and when I was 18.
Wow.
And then also I had other experiences on the backboards talking to the patients, and they're telling me they'll never get out because they even though they were there as teenagers, but they didn't learn what they needed to learn to go out into the world. And
Yeah.
that was really researched quite a bit back in the 1950s and 60s, to prove that they didn't learn anything. They became accustomed to staying in these mental institutions, which were huge, up to even 10,000 people, in these housed in these buildings. And so I learned about that, and I learned about this older person who hadn't talked for 5 years, and she was on one of the wards, and I chose to sit near her and talk to her. And she said some words to me. She said, "I wear glasses too." And those are the first words she had said, apparently, in 5 years. And I told the nurses on the floor that, and they didn't believe me. They said, "No,
Mm.
she never talks. She hasn't talked in
Ah.
5 years."
Mm.
So that was sitting near her and following her around. But there were no programs for her, nothing, to just sit there in this big room they called the day room. And that was it, you know, before it was like a prison for her in that sense. There was
Right.
no activity.
Wow, Christine.